I delay the MMR vaccine until my child is older?
Yes, you can delay it, but it's not something that we advise. The reason why we do not advise delaying getting the MMR vaccine is because your child has a high risk of getting measles, especially in Minneapolis or in Minnesota or cities where we're not at 95% already. In order for us not to be worried, is that when we have a 95% of the community or the population being vaccinated with the MMR, then we have herd immunity. But right now, we're not there. So therefore, getting your child vaccinated on time and both doses will give your child the highest chance of not contracting this contagious disease.
What happens if I don't get my child vaccinated with the MMR vaccine?
That is putting your child at high risk for contracting this disease, right? A disease that is preventable just by getting vaccinated. This vaccine has been tested, has been proven to be effective, and 97% effective at that, right? We don't get a lot of things that is 97% effective with the second dose. And two, it is what happens is if that child was to get measles, it wipes away all of their immunity that they have built up. All of that when your child first got their flu vaccine or whenever any other vaccine that they've gotten, think of it as a bank that keeps track of all those immunity, and it can wipe away 5 to 50% of that, if not more. So it puts them at a high risk for contracting other flu or other diseases that they should not get because they're already vaccinated for it. So definitely causes a high chance for them to get sicker next time that they do get with simple flu.
Is there really a risk of measles in Minnesota?
Minnesota has, like any other state, we're not at the 95% mark. We're not at a place where we can say, okay, we can relax. Back in the 90s, I would say, even like in the early 2000s, we were at a place where we could say, yes, we're not at a high risk or we're not at risk for measles. But right now, yes, we are. And there are communities that are higher risk than others also. So if you are in a community that is not vaccinating or that have a lot of questions regarding the measles vaccine, this is the time to speak up, ask questions, ask the things that you want to learn, and see if your questions are being answered.
How serious is measles really?
Measles is very serious. To some people, they may only have minor symptoms where they go, oh, my child got it before, and they only had flu symptoms. Good for them, and I'm happy that that's all your family has experienced. But other people will experience getting ear infections, will get pneumonia, where they end up in the emergency room, where they need to be on a ventilator, where they cannot breathe for themselves. Others will get more complications, such as even death. So we need to take this seriously, and it has to be thought of, how can I take care of others, even if you didn't think of it yourself, but how can I take care of my neighbor? How can I take care of my sister or someone who may not be able to take care of themselves? And for me, that is a driver, is why I do what I do or why I vaccinate my kids. I would hate to choose not to vaccinate my child, and then that's the one that ended up getting someone else really sick or maybe even die from this. So taking ownership is how I would think of it.
Are the ingredients in the MMR vaccine safe?
What ingredients are in the vaccines, especially the MMR vaccine, and parents being worried about it being harmful to their child or putting something that's harmful to their child, whether it's, does it have mercury, does it have pork in it, does it have human cells in it, or something that can change their genetic input, right? Or even the vaccine was studied with us without someone that looks like me in mind, and that fear. I get that. And those are legit questions, but a lot of the time, what happens is parents are not asking those questions to their providers. And the reason why your provider is there is to answer your fears and to talk you through it and have that conversation and explain to you what is in the vaccines. And I would say, advocate for yourself, advocate for your child. The way that you do that is asking what is in the vaccine. Once you ask those questions, if you're confident in the answers that you get, I will assure you that you will end up getting your child vaccinated. Honestly, the measles vaccine is one of the vaccines that has been really tested. It's one of the longest vaccines that we've looked at, and even better than most of the medications that we take today. So if you look at your cabinet and you looked at how many medications that are in there, and we compared it to what is in the MMR vaccine, you will see that you have less risk factor with the MMR vaccine than some of the medications that you are giving your child or you may be taking yourself. I understand that it's very scary. It is something that most of us are like, I'm not used to it, I don't need it, and prevention is not something that we think about all the time or had the luxury to think about, right? But this is one preventable disease, and the way that you can prevent it from your child, or as I talk about all the time, others that you may engage with, is simply getting vaccinated. It's something that I stand behind, and it is why I give it to my own kids.
Is it too many vaccines for my baby? I am worried too many vaccines at once can overwhelm the immune system.
That is a good question to ask. And I know some parents are worried about, am I giving my child too many things that I don't even know what it is or what's in there or what can cause an issue, or even think of it as a preventative thing, especially in poor people that did not have the luxury to think about vaccines before, or all of a sudden having all these options where they do have to vaccinate and give it to their kids and think about different things, whether it is understanding the language, whether it is understanding what is in there, or not even having the ability or the comfortability to ask their providers questions. I can see how there is that hesitancy where we're like, I'd rather not get it, or say it's too much, or I'll take one and not do the other, or do the ones that I am comfortable with. I know a lot of my patients go, I know what hepatitis is, I'll give them that. Or they will say, I know what this is, I'll give them that, but may not be familiar with the MMR vaccine or may have heard too many things that they're uncomfortable with. But this is why providers are there, and I think a lot of us are wanting to have this discussion.